The anal canal is a short tube surrounded by muscle at the end of your rectum. The rectum is the bottom section of your colon, large intestine. When you have a bowel movement, stool leaves your body from the rectum through the anal canal. Cancer begins when some of the body's cells divide without stopping, and this could cause an unusual leakage. According to American Society of Colon and Rectal Surgeon, discharge, mucus, or pus from the anus could indicate anal cancer. Rectal discharge refers to any substance, aside from feces, that comes out of your rectum. It usually presents as mucus or pus that you may notice in your underwear or on your stool. You may also feel the urge to have a bowel movement, but only pass mucus or a very small amount of stool. Vitamin D supplements, the bathroom habit that could mean you've taken too much. Other symptoms of anal cancer include bleeding from the anus or rectum, pain in the anal area, mass or growth in the anal opening, lasting anal itching, change in bowel habits, e.g., having more or fewer bowel movements or more straining during a bowel movement, narrowing of the stools, swollen lymph glands in the anal or groin area. Pfizer booster shot, the unexpected side effect after third dose, insight dementia breakthrough, the daily food to eat that strongly reduces the risk of decline. Latest Omicron, a specific pain is occurring in patients struck by the variant. Doctors update, expert advice. Who's at risk? Age, 55 and older, anal sex, sexually transmitted diseases, multiple sex partners, smoking, history of HPV-related cancers, especially cervical, weakened immune system due to HIV, chemotherapy, or having an organ transplant, chronic inflamed areas that cause long-term redness or irritation, such as anal fistulas or open wounds in the anal area, prior pelvic radiation therapy for rectal, prostate, bladder, or cervical cancer. It's best to follow up with your healthcare provider if you notice any kind of rectal or anal discharge, especially if you've never experienced it before. Based on your symptoms and medical history, they may perform a range of tests to narrow down a diagnosis. If you're not comfortable talking to them about your symptoms, you can always ask for a referral to a specialist who's used to dealing with rectal and anal health concerns. After anal cancer has been diagnosed, tests are done to find out if cancer cells have spread within the anus or to other parts of the body. Different types of treatments are available for patients with anal cancer, with some being standard treatments and others being tested in clinical trials. Unfortunately, the cancer may come back in the anus or other parts of the body, such as the liver or lungs.